Director, yes.
Thank you so much for being with us today.
It's an honor to be on your show.
I am so excited to have you here. You have been at the front lines of all of these issues that affect human services, human rights, for decades, for absolute decades.
I have. I think I'm a lot like you. We are change agents,
Oh, I hope.
and there's plenty of change that needs happening.
Yeah, there absolutely is. But let me tell you what I've heard about you. I could not find one article about you that did not speak to your integrity, that did not speak to your commitment to human beings and the issues that affect human beings. You were one of the longest serving elected officials in Wisconsin, is that correct?
Yes.
And you started an organization there that increased access to people who were uninsured and underinsured and tried to increase the efficiency of those service delivery systems. Amazing, just amazing. I also heard that you were a great driver and you never get lost. And if you did get lost, however, you would certainly stop for directions. I heard that too.
Well, women do that. We
Yes, we do.
ask for directions when we need it.
We do. So what do you think about, why do you think this Affordable Care Act is so important to this country?
Well, for, decades and decades, so many 30, 40 million people in our country have had to live with the incredible worry, terror, that they were one illness away from bankruptcy, let alone one illness away from life-threatening disease. And so when you think of this, the trauma and the stress and the cost that has imposed on them personally, and yet all of us as a nation, there are so many reasons why Congress and the President were so correct in giving us this first time ever in our nation's history a chance for people to go to one marketplace and compare and shop and buy affordable health insurance. President Obama got it done. If it had been easy, it would have been done a long time ago.
Absolutely.
It wasn't easy, and he got it done.
What do you think the best thing about this legislation is?
Well, I'll just tell you what people say.
I'd like that, yeah.
So I'm talking to a gentleman just a short time ago. He says, I'm 36 years old. I got to buy health insurance on this marketplace, and it was the happiest day of my life. And I said, tell me, why? He said, well, about 10 years ago, he was in college, and he knew something wasn't quite right. So he went to a doctor, and the doctor said, we really ought to do a CAT scan. And he said, well, I can't afford a CAT scan, so he didn't have it done. 2 years later, stage 4 cancer diagnosis.
Oh my.
He has spent the last 10 years battling cancer. The stress of just that alone, let alone the bills he would regularly get in the mail. And it got to the point where it no longer stressed him out because he had to laugh. There was no way he was ever going to be able to pay any of them. So that was an example of how this law has changed people's lives.
And I think it's sometimes easy for us not to recognize that sort of anguish is out there. And I think it's also easy for us as a country, unfortunately, not to think about the impact that sort of angst and that sort of exclusion from routine primary health care, the impact that it has on this nation.
And it's tied to so many issues. I mean, think about infant mortality.
Absolutely.
And the issues that people in Toledo have struggled to try to change for children. Just single-handedly having better preventive health care, which is what the law requires for pregnant moms, will make a difference in infant mortality. Absolutely. So the ramifications of this law are long-standing and will last forever. It's very exciting.
It is. My personal philosophy is one that says that everything in our lives is about politics and healthcare. Those two things. And I think that we talk about issues like affirmative action, to use a phrase that I don't hear very much anymore, but you cannot level playing fields on any other indicator, education, economics, unless you level the playing field relative to health.
Yeah, your point is so well taken. One really great example that is when children are sick and don't have health care, they don't go to school.
That's right.
And if children go to school, we know what happens. And so it's tied to everything. If you're sick and you can't go to work, you get fired.
That's exactly right.
It's tied to every economic, social, human ability of us to succeed. So it really is the glue that keeps the economy ticking, but more importantly, keeps us ticking.
Yeah. You know, one of the things that I think distracted this conversation from its benefit, from the benefits of the Affordable Care Act, was the frustration around just getting it started.
Yes, the website itself had, as the president would say, it was not a happy day, and he of all people wanted it fixed. And he and Secretary Sebelius, the head of the Health and Human Services Department, they got it fixed. So since December 1st, it has been functioning really well. Just to give you an example, the first deadline for the Affordable Care Act came on December 23rd. Where you needed to sign up if you wanted your coverage to start on January 1st. On December 23rd alone, when a whole lot of people were probably baking Christmas cookies or doing that last minute shopping or things like that, 2 million people were on the website on that day, and it functioned beautifully. So the website's operating great. Just go to healthcare.gov website and you can shop. You can then go back and think about it. You can come back and buy. Or you can buy through an insurance agent or broker also, or you can get one-on-one assistance. So if you're old like me and the computer stuff isn't so easy to do, then you can go to someone right here in Toledo and talk to a real human being, sit down in their office or on the phone and get assistance for how do I do this, or am I putting the right information in, or what are my choices, and they will help walk you through it. There are sisters in every community. And you can find that by just calling the toll-free hotline, who will tell you who you can talk to locally. But that toll-free number, is that all right if I give it, Donnie?
Absolutely.
Is 1-800-318-2596.
Yes. And as Director Falk says, we will provide that additional information to you that will allow you to contact that assistance. We do have very strong assistants here in Lucas County. We'll tell you how to reach them, and we will also give you the additional online information before the end of the show. So for those folks who would say, given everything that you've just said, for those folks who would say to you, but Director Falk, the government's really broadening its reach here. I mean, why is healthcare within the purview of the government to manage? What would you say to them?
Well, the Supreme Court has answered that question, and the Supreme Court upheld the law. And so it is the law of the land, and it is a fabulous new day. You know, we've talked a little bit about the many in Ohio, including right here in the Toledo area, who are uninsured, and it's about 14% of the population. So in Ohio, that's over 5 million people.
Yes.
But what we haven't talked about yet, too, is all of those who already had insurance. So the 86% of Ohioans who already had insurance and don't need to go to the website, they don't need to call anybody. They have their health insurance, they're pleased with it, they keep it. For all of those people, the Affordable Care Act, upheld by the Supreme Court, has already made a huge difference. And let me give some examples. Before the Affordable Care Act, it was okay for insurance companies to charge us women more than men for health insurance.
Yes.
No longer can they do that.
That's right.
Up until the Affordable Care Act, an insurance company could cut you off when you reached a certain limit each year or over the lifetime of your policy. No longer can an insurance company do that. The most important one, though, was if you had a pre-existing condition, asthma, diabetes, high blood pressure, cancer, an insurance company could say, we're not going to insure you at any cost.
That's exactly right.
They can no longer do that.
And think of the impact as well of the ability to get free preventative care for some issues. Amazing opportunity to impact the incidence of breast cancer, for instance, other women's health issues. It's a pretty significant
So the provision you're talking about, which is in the Affordable Care Act, that requires no cost sharing, no deductibles, no copays for certain preventative measures like screenings, high blood pressure screenings, 2 million Ohioans already have taken advantage of that, as they ought to.
As they ought to, as they ought to. I work at a place, my other job, I have another job, not as much fun as this job, but I have another job, and it is the director of a community health center system here in town. And one of the things, we see the most complicated patients on the planet for all kinds of reasons, because of formerly a lack of access to insurance, and so they wait, people wait. People are very proud despite the discussion that you might hear that would indicate otherwise. And so people wait if they don't have resources to pay until their conditions are at a level that are not only complicated, but terribly expensive for the system and for themselves to treat. Right. And some of the issues that we have seen change even now are an excitement about being able to say, I have insurance. An excitement that says, you know, I'm as good as anybody else now because I'm not one of those people that you've pushed aside and made less important, minimized. I have insurance. It's one of the best unspoken results of this. Dignity. Thank you, dignity. One of the best unspoken results of this initiative.
Well, I am very familiar with your clinic. And I am very familiar with your history of service and leadership. It is fabulous.
Thank you so much.
Thank you.
Thank you.
Just the difference that makes in so many lives is really exciting.
We're going to go away for just a second, but you'll stay with me.
Yes.
Right? Thank you so much. We will be right back in just a moment, I promise.